I'm Dr. Lauren Maskin. I'm a pediatric hospitalist. I've been here for over 8 years. And I'm also the medical director for Inpatient Medical Surgical Services, which is a long fancy name for saying that I'm the medical director for all of our non-ICU units. Even my process for coming into work is different. I have to make sure that I have my cloth mask in my car or my purse, and I put that on in the garage. I wear my ID up on my shoulder so that it's readily visible, because it's the only opportunity that people are going to have to see my face. I switch into my ear loop mask when I get to the hospital, and then I make my way to our office area, where I still have multiple additional steps that are new due to COVID. So I've got my mask on, now I have to put on my goggles. So it's very hard for anybody to see my face. I have to have my temperature taken. I have to go find my BioVigil. And that's all before I even hear about my patients for the day. So it feels very impersonal and disconnected. And yet I have to, in the span of minutes, walk into rooms of patients that I've probably never met before and try to make a connection with them and try to make them feel safe and cared for. And sometimes I'm doing that admission and that discharge all in one day, and they don't even get to really see my smile. It's hard to connect with the kids because they get scared as soon as they see a gown, and they just assume that I'm going to do something to them and they're going to feel hurt. So my opportunity to play with them and let them see that I'm a person is strained. So it's really hard to feel that connection with our patients and our patient families. Our community needs to know that we are exhausting our healthcare workforce. And in pediatrics, a lot of our energy has been spent just in planning and making changes and trying to figure out how to evaluate and manage MISC. But our adult colleagues are being burnt out by this. We are exhausting them every single day. We're asking them to risk their own lives and exposing their families by caring for these patients every day. And we are burning through the resources that they have to do this properly. So this is not just about, do we have the treatments to care for this? It's, do we have the people and the resources to do this long term? And I'm fearful that we don't. And I think that as we all make our individual choices about whether to mask, whether to go out in public, et cetera, we really need to be making those decisions based on how it impacts our neighbors and our healthcare workers in the city and across the state, because we have to keep in mind that they are a precious resource and there's no backup to them.